Wisconsin refugee workers have helped fill some of the gaps in our workforce, but changes in federal policy are forcing one statewide organization to change its approach to refugee job placement. Chloe Morrissey has you covered on how Leading Age Wisconsin plans to continue supporting refugees.
Leading Age Wisconsin has spent years welcoming and training refugees to help care for the state's aging population, but with fewer new arrivals because of recent federal policies under the Trump administration, the focus is shifting. Recruiting healthcare staff already poses a challenge amid the ongoing workforce shortage. That's why Leading Age Wisconsin looked to fill those gaps with immigrants and refugees.
Before, I was getting referrals from the resettlement agencies asking, I've got X amount of clients that we're working with. Can you help us find placement in a long-term care facility?
But because President Donald Trump's policies block some refugees from entering the United States,
we're not seeing that anymore.
Robin Walzenberg is the Senior Vice President of Clinical and Regulatory Services with Leading Age Wisconsin, representing nonprofit care providers for the elderly. Her work with refugees started about 3 years ago.
A lot of the people who come from other countries were caregivers in their home country, generationally speaking. So this was just a kind of a shoe-in to thinking they're going to be able to do some of those skills.
And ever since, it's been a success.
They are hard workers. They want the American dream.
And the refugees Walzenberg has placed hold an 85 to 90% retention rate compared to domestic workers where she sees a higher turnover rate. But since refugees can't enter now,
we're just having to shift our focus, from those coming in to those that are already here and really looking at career opportunities for them.
Walzenberg hopes this new focus of training and retaining refugees already in our communities can help fill the shortages we're continuing to see in healthcare. Reporting in Madison, I'm Chloe Morrissey.